The end of this week, target risk groups across Rwanda will receive their first COVID-19 vaccine doses. The first shipment of COVID-19 vaccines through the COVAX initiative arrived in Rwanda on Wednesday morning aboard Qatar Airways. Through his Twitter handle, President Paul Kagame wrote that it is good news that a number of African countries have started receiving COVID-19 vaccines. The head of state noted that it's been a long wait for Africa, with some countries better prepared or even more ready to receive the urgently needed vaccines. The Minister of Health, Dr. Ngamije Daniel, told RBA that health authorities have already identified people in priority risk groups who are first on the queue to receive the jabs. The target risk groups who receive the first doses of COVID-19 include the health professionals, those above 65 years old with underlying health conditions, and other frontline workers such as security personnel, among others. As of Tuesday, March 2nd, 2021, of the 19,111 people diagnosed with COVID-19 in Rwanda, the number of people to have contracted the virus over the age of 60 was 1,386, according to the Ministry of Health. Although the numbers may seem small, when it comes to the death toll from the pandemic, the elderly form the biggest number of fatalities registered so far. Out of 265 people killed by COVID-19 pandemic in Rwanda, 179 are men, while 86 are women. Of these COVID-19 fatalities, about 156 people, representing 3/4 of total death, were over the age of 60.
Among the most fortunate to be sick, go to the hospital, and some even die of COVID-19 are people within the age range of 50. To those, COVID-19 is really a serious problem. As people grow older, they develop several illnesses such as cancer, high blood pressure, diabetes, respiratory complications, and other diseases. When such a person contracts COVID-19, they are more at risk of death than the younger person.
The arrival of COVID-19 vaccines in Rwanda has been welcomed, especially by people who fall in the category of priority risk groups. I have high blood pressure, which is very severe. I have no strength. I would be very happy to get vaccinated because I have heard that people with underlying illnesses are at risk of being critically affected by COVID-19. I thank the government of Rwanda for taking care of its elderly population, protecting us so that we can live longer. At the age of 73, vaccination would be enough to prevent me from contracting this pandemic or even infecting others. And I've heard it's being said that adults are at a higher risk of severe illness from COVID-19.
I am 68. Vaccination would protect me from being infected or infecting others from the coronavirus.
The one UN resident coordinator, Ford Ndiaye, praised Rwanda's effort to build sustainable health facilities and protect people from COVID-19 pandemic.
And Rwanda is one of the first countries really in the low-income country to have that ultra cold chain that help us have the logistic that is required for this Pfizer vaccine, which is owing to the strong preparedness, strong commitment of the government.
The Minister of Health, Dr. Daniel Ngamije, has reassured the population that health authorities have undertaken all necessary measures to ensure the safety of COVID-19 vaccines.
Vaccines are really safety because they have been approved by WHO, which is a regular health institution worldwide to regulate these kind of things. So they got the approval of WHO, these vaccines, and also from very stringent regulatory agency like American FDA, European one, and our own agency. We also went through the dossier and we were satisfied with all criteria that we reviewed. So I believe that these vaccines are reliable. Everyone can take it, whoever is eligible for getting this vaccine.
In addition to the more than 342,000 COVID-19 vaccines that arrived in Kigali on Wednesday, including 240,000 doses of AstraZeneca Oxford vaccines and 102,960 doses of Pfizer vaccine. The Minister of Health revealed that there are plans to receive more vaccines on a monthly basis. However, The Minister of Health says children under the age of 18 are not covered by these vaccines. The COVAX initiative, a global effort to provide vaccines, intends to provide free COVID-19 vaccines to participating countries, which can cover at least 20% of their population by 2021 to protect those at most risk for severe forms of COVID-19 and save lives. Reporting for RwandaTV News, ATHAN TASHOBYA.